Welcome back to the Business Forum Show. I'm Kevin Hunter. My special guest in studio today, Dr. Jeff Schneider from Hillside Chiropractic. Welcome to the show, Jeff.
Thank you, Kevin.
Get us started by explaining a little bit about your clinic and really what some of the services are that you have available through Hillside.
Well, first and foremost is obviously I offer chiropractic stuff. I am a chiropractor myself, so I do the adjustments, but I also do a lot of muscle work. I believe that you need to do a lot of muscle work in order to really help the patient fully. And so we also offer massage therapy, acupuncture, and nutritional counseling.
Okay. Now, there's a technique that you use in your clinic, which we've visited about numerous times, active release technique. Describe what that is and how that supports your chiropractic practice.
Well, with many injuries, whether or not you've had surgery or just chronic trauma to an area, develops scar tissue. And that scar tissue starts to build up and build upon itself until the joints and the muscles just aren't moving properly. Chiropractic normally just adjusts the spine to address the function of the joint, but also there's another component with the muscle and the soft tissues, which ART addresses. So I combine both of those together, so I think I get much better results that way by not only getting the scar tissue removed, but also getting the joint to move so I can continue to move after I get done giving that adjustment.
Give us an example of some extreme cases that you've dealt with where a patient has had chiropractic help with whatever their ailment is, and with the use of ART, you've been able to overcome whatever limitations just common chiropractic has.
Well, I just had a patient in the last year here that actually I'm going to be doing an ad on in the paper coming up shortly here that was seeing another chiropractor for many years after breast cancer surgery.
Mm-hmm.
And as a result of the surgery, she had a lot of scar tissue in her chest and shoulders and started getting pain down her arms and some swelling into her arm where she actually wasn't able to hold a pencil and do things like that due to the swelling in her left hand. Her chiropractor knew that she needed something more and said that he believes that she had, some scar tissue in there from the surgeries, and ART would be the best thing to address that. So he actually referred her to my office, and with some ART, we're able to get into that scar tissue, break that up, and get the lymph flow back into that hand the way it should be, so the swelling went away, and she's symptom-free now.
Very nice. So explain why, if scar tissue is harmful to normal function and whatnot, what does your body create it to begin with?
Scar tissue is created after a surgery or a trauma to heal up that area, but it also does that even with like the micro trauma. If you do the same thing all day, like work an assembly line or always a computer mouse, that trauma adds up. Every time you do that, you're using that same muscle in the exact same way, and after a while, those muscles get weak. When they get weak, the body goes in there to try to restore some of the proper strength in that tissue there and puts down scar tissue. And when it builds upon itself, it ends up shortening up the muscle and restricting all the motion in that muscle. So it's doing its good, but it's not all in the same direction, and all the fibers have to be in the same direction in order for you to be able to stretch properly.
So scar tissue isn't just a response to injury, but can be from what you just described as a repetitive type cycle, which could be true of almost anything you do.
Yeah, even, not just always, using something a lot. Actually, just being stationary and stagnant too long can also create scar tissue. If you have poor posture and sit all day at the desk, those muscles get pinched and squished and never really get stretched. They can also develop scar tissue.
Interesting. That was one thing I never realized. I was aware on why that the body created scar tissue, but I always thought it was related to injury as opposed to just as you said, sitting in one place or doing a repetitive type thing like assembly line. I like to play a lot of tennis. I imagine you're using the same muscles and that sort of thing. So I imagine you can get scar tissue from that as well, even though you're not technically hurt.
Yeah, I get the same questions every single day from patients that say, well, I never had any accidents or I never had surgery. How come I have scar tissue? Or I lift weights and I'm using these muscles all the time. How come I get scar tissue? Mm-hmm. But just if you're not active, you can get scar tissue, but you can also get it by being overly active and lifting weights and playing sports. Definitely creates scar tissue.
Sure. Well, interesting stuff. So take us back to when did you first open your clinic up?
I opened up in January of 1999.
Okay. And was that right after following your graduation, or when did you graduate from college?
I graduated in August of '98, so it was shortly thereafter I started working on finding a place to open, and it was it needed everything. The office was a dirt floor when I got there, so I had to start from scratch. So
Interesting. Sounds like an Abraham Lincoln kind of thing.
no, it took some work because you get into school and you think you're going to walk into some kind of office and be built for you, and you have to decide what you're going to do and how you're going to build that. So it took some work.
hmm What challenges were you faced with as far as some of the early stuff? Because I can imagine, I walk into offices today and you see all the tables, that chiropractors use and the different equipment and stuff like that. What were some of the challenges that you had opening your clinic on day one?
Everything was a challenge to begin with because we're trained very well to be chiropractors. We're not trained that well in the business side of it, so I wasn't sure what all to buy, where to get it, how to design my office, because unless you really worked in one for a long time, you don't know, how the flow is going to work in your office. And then also, just trying to limit overhead, but making sure you buy what you need, but not more than you need.
Mm-hmm.
And then once we did open, obviously how to figure out how to market yourself and how to create your own niche, in the market was a big thing too.
Sure. Take us a little bit into your college background, because you mentioned before the show about a internship that you went through. Was that internship really for learning how to apply the chiropractic side of what you're doing, or did you have a chance to study any of the business models that were out there?
There's 10 trimesters in the chiropractic college. So the first 5 trimesters, you're actually a patient for the people in the 6th and 7th trimesters.
Mm-hmm.
So when you're in the 6th and 7th, you get to work on patients, and you have like 4 or 5 patients that you work on every week. So you kind of learn the treatment side of it. And then when you get into the 7th and 8th, or 8th, 9th, and 10th trimester, you actually get to work in a clinic.
Mm-hmm.
So you get to do a little bit more working on some paperwork, seeing how the paperwork side of it works with insurance companies and things like that. But there's not a whole lot of really business sense, because these are all established clinics, and you're just there to kind of help out the doctor, do some paperwork, and treat some patients. So you don't really learn the other sides of that you really need to.
So you're really just following a structure that's in place. You don't necessarily know why it's there or what its function is.
Right. Yeah. Mostly it was the 8th and 9th trimesters. You're working with a clinic that's affiliated with the chiropractic college. So
Sure.
they already have their way of doing it. So you're kind of following that. So
Give me an idea of what your introduction was to working with the insurance companies that are out there, because they are all over the map in terms of what they cover, what you have to do in terms of paperwork and whatnot to even get paid. Walk us through a little bit of that insurance nightmare, because I have to believe it is one.
yeah, it is. And it's thanks for bringing that up. But actually no, it's never easy, because you don't really know exactly when you get out of school how it all works. So it was tough to find out what kind of software you need to use, if you are going to have a clearinghouse for it, if you're going to directly bill it, and then trying to figure out each insurance company has different codes that they allow, and for the same things, basically chiropractic, you're doing most of the time the same things on every patient,
Mm-hmm.
with some variations depending on what their problem is, but each company has different ways you have to bill the exact same procedure. So it was kind of tough to know. Sometimes we'd get denials on some things. We'd be like, well, this is exactly what we got paid. The other one, they're like, well, we don't accept that. We accept this. So it was a lot of trial and error for a while there.
Now, did you ever have a situation where if they told you the coding was incorrect, could you correct it and rebill for it? Or
Yes, most of the time you can do that. So there was a lot of rebilling originally.
Nice. Well, when I think about what you've just described as far as your college background, what you went through as far as your internship is concerned, and even the interface that you had with these other established clinics out there, the business side of what you were doing was limited, obviously, but still, you've been around for 14 years, so you figured out some things in there to really make things work. What are some of the things that you employed early on in your business that allowed you to survive that, even though you really didn't have the background to run a business?
I think one of the main things was I just try to keep my overhead low, and so that I could, there's some lean times right away, and I wanted to make sure I didn't go overboard and really have a tough time with that. So the first couple years was, not doing a whole lot outside of the office, trying to save money that way, and then also keeping my overhead low so that I could make it. And then I tried to do a lot of inexpensive marketing was the main thing.
Sure. So by keeping overhead low, did you have anybody working in the clinic beside yourself?
Yes, I had a front desk staff. So just one person, but that was, it was something that cost money, but it wasn't, something you need to have to. You look professional if you're just sitting there by yourself waiting for somebody to come in. Doesn't look too professional either. So
very nice. Well, we're visiting with Dr. Jeff Schneider from Hillside Chiropractic. You can find him on the web at hillsidechiro.net. You can also call the office at 763-241-5393. I'm Kevin Hunter on the Business Forum Show. Don't go away. We'll be right back.